Okay, so over to you,
Yes,
Dr. Eve, then.
I'm happy to do that. Thank you very much for joining us this afternoon. And I want to sincerely thank our mentors who have availed some time to speak to our upcoming scientists, both from the program side, from the creative art side, from the academia, scientific writing, even journalism. Quality communication to get information or key messages across is very important. And as we move out to go and deliver our presentations at the various conferences, we have the Palliative Care Association of Uganda conference this September. We have a conference on human rights and justice this September. We have the African Palliative Care Association conference that is happening in Botswana. And next year, we have the Kenya Hospices and Palliative Care Association conference happening, guess where? In Mombasa. Therefore, we want to empower all our scholars to be able to present their work with precision and never know who is going to listen to the key messages you're putting out and what opportunities can be opened up to you depending on who listens to your message. And if you want to be proficient, please pay attention and pick some nuggets from the people who are available to us this afternoon. And I'll introduce the various people we have. And we have Jo Mastron. She has already introduced herself briefly in the chat. And she says she's from South Africa, and she's the founding member of Palliative and also works with Sunflower Children's Hospice. Joanne, thank you very much for accepting to be here with us to mentor our upcoming scientists, actually, and creative arts professionals. And then we also have Dr. Zippy, who was the former executive director of KEPCA, Kenya Hospices and Palliative Care Association. She's a board member at the African Palliative Care Association, and she continues to do a lot of work to support the development and increase the access to palliative care for everybody who needs it in Africa and beyond. And we also have Dr. Ludo. Dr. Ludo, please put on your camera if possible. Yeah, so Dr. Ludo is another scientist with the London School of Tropical Medicine and Hygiene. Dr. Ludo, kindly unmute a bit and say hello to our audience.
Hello, everyone. Thank you for giving us this time, and we hope that we shall learn together in this 1-hour session.
Thank you. And then we have Dr. Kennedy Nkoma from the Cicely Saunders Institute, King's College London, and also a member of the African Palliative Care Research Network. Dr. Kennedy Nkoma, if you're online, kindly put on your camera for a minute.
Hi, everyone. Thanks, Eve, and thanks the team for joining. Happy to be part of this conversation today. Thank you.
Great. So you can see we have a lot of people who have committed their time, and they are here to support all of you. And people online, please note that this session is being recorded. We have a team of scholars at the Institute of Hospice and Palliative Care. Right now they are in class, but this recording is going to be shared with them. And we want them to be very active in communicating effectively and disseminating the findings that come from their various research projects. And this is how we are going to run this session. We are going to have some brief talks from the presenters, And that is to orient you, to ground you, and to help you appreciate why you need to be effective in communicating. And then after that, we'll break out in smaller rooms, and those who have their slides can put up their slides and get some comments from the coaches who will be in those specific breakout session rooms. And you who will be presenting, thank you for offering yourself to share your slides. And then those who will be in the room, please learn as this person presents her slides and gets constructive feedback. And then maybe at another time, you can also present your work and you receive constructive feedback. And this is the way you learn. And a time will come when you also have to mentor another person. So please take the session seriously. Those are the brief introductory remarks from the African Palliative Care Association. And now I'll hand it over to Dr. Zipporah Ali. Thank you.
Thank you, Eve, and thank you for the APCA team for organizing for this session and for asking us to share some insights into making an oral presentation, actually an effective oral presentation. I'm not going to say I'm the best. I usually have some weaknesses myself, and that is I talk very fast. And so I will try to talk slowly. I remember when I decided doing a lot of talking, presenting, especially when I was working with the Kenya Hospice and Palliative Care Association. I had to attend many conferences, I had to attend many meetings, and I had to do a lot of presentations, including even giving keynote addresses in international conferences. And this was really scaring for me initially, because I really, basically, I'm a clinician. That's what I was comfortable in. And now here I was being asked to, let me get this into slides slow, being asked to make presentations to very, very many people. So I would be very nervous. I would speak very fast. And the end of the presentation, I would realize the people I've been speaking to are looking at me like they did not understand what I said. And so I was lucky when I was working with KEPCA in the early years of setting up the Association for Hospice and Palliative Care in Kenya. I was invited to take part in a training on leadership in palliative care in San Diego through a program that was run and still runs with the oncology teams by Dr. Frank Ferries. And one of the things we had to do is learn how to do public speaking. And so there was a Ron Cameron, who was very good in public speaking, and he was very, very, I think he really helped me a lot. There's a time I had to go and speak at the UN Health Assembly to actually talk to presidents about the need for palliative care. And I had to practice my presentation. I had to practice what I was going to say. It wasn't going to be a PowerPoint presentation. I was going to read it. And I was going to, as I read it, I was going to, of course, make sure that it has the passion and compassion that I wanted people to understand by telling my own story, my own experience. So Ron worked a lot on me to be able to make me speak slowly and engage the audience. And I remember he always said, kiss the mic, because some of us, when we are speaking, we actually hold the mic at our abdomen so people don't get to hear what you're saying. Or sometimes we hold the mic so close to our lips, to our mouth, that it actually echoes. So these are some of the things we are going to talk about today. I'm just going to make an overview of how to make a good presentation. And then my colleagues on the panel will also add in a lot, especially from maybe the experiences and how we can actually engage ourselves in how we can make good presentations that will engage our audience. So as you've been told, my name is Zipporah Ali. I'm a palliative care physician and a public health specialist residing in Kenya. I'm retired from employment, but I continue to work as an advocate, trainer, and also a researcher in palliative care and beyond. So the objectives of this session are really to look at, how can we equip ourselves with the confidence we need, with the skills we need, with the knowledge we need to be able to give a good presentation. And we are hoping that many of you are also coming to the APCA conference in Botswana and are going to be presenting to us during the conference, to the audience during the conference. So we are hoping that also this can prepare you for that session, for the sessions you're going to be engaged in. So I'm hoping that by the end of these sessions, we can really know how to engage and inform our audience, and also make our presentations very clear, prepare for our presentation strategically, organize our presentation, how to use verbal and nonverbal communication, and then also how to deliver the content, what we should expect when you're delivering the content, and also how do we end our presentation. The main thing is we want really to make sure that people understand what we are talking about. We engage the audience. Our message is completely clear. And I tell you, when you do this, and sometimes in our conferences, we have editors from very good peer-reviewed journals who will come to you and say, we're interested in publishing your paper. And I know most of you want to publish because publication is very important in our career. We want to be able to share our research. We want to be able to share our reports with the rest of the world so that we can see how we can improve palliative care in our settings and different other settings as well. So I don't know if some of you feel like this lady. I used to feel like this lady. I would be shaking, I would be sweating, I would be stuttering, and I would just be doing the wrong things when I'm supposed to be presenting. And this is normal. Making an oral presentation to a large group of people, or even a small group of people, can be very intimidating for us if we have not prepared ourselves well, and maybe if we have not had the experience of being able to present in a conference or a workshop. So I am just going to run through some tips that we can use to help us do an effective presentation. And then, of course, we'll discuss this as a panel. So there are many tips. If you go if you read about oral presentation, you'll come across many things that you'll be told are good to be able to help you do a good presentation. I'll just talk about some of this, and we'll also talk about them in the panel. So what should you do in preparation if you're going to do an oral presentation? How do you prepare yourself? Do we usually prepare ourselves, or I used to be one of those people who would wait a night before and then start working on my slides. And I realized that was a disaster because I would be messed up when I'm presenting. These days, I really prepare my presentations very early. For example, I'm going to be teaching in Lesotho in October. My presentations for teaching there are already ready, my slides. And I keep on going through them every now and then to update them and to ensure that I'm familiar with what I'm going to be talking about. So preparation is very important. When you're going to do a presentation, you should take your time to prepare for it very early. So before you present, you should understand what you're going to be presenting, the topic you're going to be presenting in. Do you understand it very well? Is it clear in your mind? And do you really believe the content you're going to be presenting? Those are important things that we need to remember. And then, of course, is this a topic that we are passionate about? Sometimes you might be told, go and present this paper, and it's nothing that you really want to present. I've seen and I walked into conferences where I find somebody's presenting a paper, a presentation I made some time back, and they're reading the slides because it was not them who prepared that slide. And they have photos of maybe of my patients whom they don't know anything about, but they're trying to present. So this is not a good way to do it. It's important that you prepare your presentation and the content you're preparing of your presentation, you're passionate about what you're going to be talking about. And then, of course, every time you're preparing, even if you're going to teach a class, you always ask, whom am I teaching? Just before we set up this session, we had a very short conversation with the team on whom are we expecting to come on board, and we're told about 20 people. Some of them will be presenting at the APCA conference. And so you really need to know who's your audience. Am I going to be presenting to people who will understand my topic, who also maybe are in the same field as I? Am I presenting to people who have higher education? You might find that even when you're going to teach, you sometimes change your slides once you're told the audience is maybe community health workers and not healthcare professionals. So you might actually need to change your slides so they speak to the audience that you're going to present to. So know your audience. And we know at the APCA conference, we'll be talking to healthcare professionals, we'll be talking to advocates, we'll be talking to donors, we'll be talking to policy makers. We'll be talking to people living with palliative care needs as well. So are we engaging these people in our presentation as we talk to them? So organizing our thoughts is very important, that we have a clear message. What is somebody going to walk away with after I've done this presentation? Most of you will also remember that, will know that after presentations, usually the last slide, somebody will say takeaway messages. So what are people going to take away? What are the key messages they're going to take away from your presentation? How important are these messages? How relevant are these messages to what they do, to maybe their setup or their population or people that they engage with? So again, one of the things that is also very important is practicing a presentation. And I learned this when I was doing the leadership fellowship. I never used to practice my presentation, but these days I actually go in front of the mirror and practice my presentation. I can do it so many times because sometimes I practice, I get, my mind goes somewhere else and I make a mistake and I come back and, ask myself, is somebody going to understand what I'm saying? And these days we have technology. You can actually practice on your laptop. You can actually video your presentation so that you go back to your presentation and see what are the things that you'd like to improve. Was I talking too fast? Was I repeating too many things? Was I saying too many I'm like me? Right now I'm doing that. So again, you look at your presentation and then try to work on it so that you have practiced it, you have rehearsed it. And also that it's fitting within the time limit you have been given. I think APCA is giving us not more than 10 minutes, 10 to 15 minutes to do presentations. So we have to make sure our presentations are within that time limit. Otherwise, in most conferences, especially the international conferences, when your time is over, they switch off the mic. So if you continue speaking, you're speaking to nobody. So again, we have to be very conscious of the time that has been given to us to present our papers. So before we present again, we have to also make sure that our slides have a strong opening remark. For example, maybe the first slide should immediately engage the audience. And also the last slide, like I said, might have the key messages to take away. But sometimes even we end with a phrase. For example, I like ending my slides when I'm talking to, when I'm training healthcare providers on palliative care. I will end usually with this Dempsey's Lee, when she says, when she talks about, we'll do all that we can to take care of you. You matter because, and the you matter because actually usually attracts people's attention, because that is the message that I want to go across, that the people whom you are taking care of matter because they matter, and we'll take care of them until the end, whatever the end is going to be. So such interesting, even statistics, maybe your first slide can say 20% of the Kenyans, for example, need palliative care, but only 2% are accessing it. And that will engage even the donor who's there, the policymaker who's there. So again, our opening and closing remarks are usually very important. And again, we can use some aids to help our presentation. We might use graphs, charts, and sometimes even photos. These have to be relevant to what we're talking about. And we try to avoid to put too many photographs and many colors, but I'm a color person. I try to make this black and white, but my learning style is actually visual, very visual. So you'll find that even when I'm reading a book, I have all different of colors in my book when I'm underlining what I want to remember. So some people have we all have different learning styles. So sometimes you also try to ensure that you kind of addressed all the learning styles. People, there are those who are researchers, they are scientists, they want statistics, they want graphs, but there are those who also want the visual things like, color, the ones who want things like even animation. So you have to kind of engage your audience with using all the different visuals that you can use. Sometimes you might even put a video to emphasize what you're saying. So again, in a slide, when you're writing a slide, we should minimize the amount of words we are putting into the slide. Again, when I was doing my training, I used to put so much word. In fact, I used to put a narrative on my slides, and I was told your narratives should be in the notes section, which remind you what you want to talk about. But your slide should have not more than 5 bullet points. So again, ensure that your slides are captivating, have a limited amount of information of them, but you're going to narrate them as you talk to your audience. So these are some of the things. And I talked about timing yourself is very important, practicing before you present. And during a presentation, also the other things we will also be looking at, for example, hoping we'll talk about things like eye contact. And again, I want to use my own reflection and example. Dr. Frank Ferry has always told us that if you are talking to people, you can decide, I'm going to look at the left, pick one person on the left side of the audience and talk to that person, but you're talking to everybody, then pick somebody on the right and talk to that person, and that's somebody in the middle. This way you engage people in your presentation. Sometimes we just talk to one person and they become intimidated. Why are they looking at me throughout? They become quite uncomfortable. We try to not look at only one person, but ensure that we are addressing the audience, different people, the audience, the corners of the audience in the room. So again, that is very important. Our body language, like you've seen, I'm using my hands to emphasize. I'm using my head to say right, left. Body language is also very important. Appropriate body language. If you're going to talk about something that is round, you might say it was round, or it was big, or it was small. So body language is very important. And we try to minimize our body language also so that people are not just spending all their time looking at our body languages. One of the things also that I remember we were taught, and I want to pass this to you, is we try to avoid using pointers, because when we are pointing, we sometimes really, point, and we're not realizing what you're doing with our hands, and so the audience is continuously following that red dot, and it's not really it actually might make them lose concentration. So if you have to, maybe you're looking at a graph, use it, but if not, then please try to minimize the use of a pointer. Again, you might walk within the room, and sometimes if you're able to, if your mic is on you, you might want to walk to the left and talk to the left, the right. But if your mic does not allow you to have movements, then you might need to be just stable where you are. So again, speaking slowly, speaking clearly, using terminology that is familiar to the people that you're talking to is very important. If you have to emphasize something, pause, talk about that thing, and then give the audience time to kind of uh, uh, understand what it is that you want them to pick out of what you've said. For them to be able to understand why you're paused. The reason why you are paused is that because you want them to really be able to chew properly what you've just told them. So again, we are told not to read our slides. I've done a bit of that here and there now. Slides are just supposed to help us to remember the points we want to talk about. If you're preparing slides and you have something that you want to say about that, your bullet point, either remember it, and if you can't remember it, if you think you'll forget it, write it in your slide sections. There's a section on your slide at the bottom of the slide where you put your notes, which can now make you remember what you're going to tell your audience. And again, our volume, the way we present the volume we have to talk out loud enough for them to understand, not screaming, but also we have to be able to express ourselves in a way that is not monotonous, it's not boring to the audience. So sometimes you hear somebody standing and they're just reading their slides and the tone is and people start sleeping. So you see everybody nodding because of the way you're talking. So again, how we present ourselves, we should be able to have a voice that is engaging to our people. The sound should be interesting to them as well. And of course, in every presentation, there will always be a Q&A session where we ask people to, we might ask people to respond to our presentation by asking questions, or also maybe by contributing to a presentation. And so again, we have to be respectful to people when they ask us questions. It might even be a challenging question to you, or maybe a question you don't want to answer, but we need to be respectful to the audience so that we can be able to answer their questions after the presentation. Usually it's good to tell people we'll do the Q&A after the presentation so that we don't interrupt the presentation. And of course, at the end of the presentation, it's always good to thank people. Be graceful and thank people for their time. They didn't have to come and listen to you, but they have spent their time coming to listen to you. So again, be aware that we need to be graceful and thank people for their time and for their attention. So these are just basic things about presentation, but I will now maybe stop here with the slides and allow for any questions. But I think we'll keep the questions maybe to the end when all the other panelists have come on board and shared their experiences. So thank you very much for listening. Thank you for your attention. I hope that some of these tips have been useful to you all. Thank you. Over to you, Eve.
Yes, thank you, Dr. Zippy. Let's hear from Joan.
There we go. Thank you so much, Zippy. I think that was an incredibly comprehensive overview and so much learning there. And so I'm just going to perhaps speak on a couple of aspects. And I think the one that to me is most important is be authentic, be yourself. If you are a quiet, thoughtful person, let your presentation include that. You can be very enthusiastic with being quiet and thoughtful. Don't try and copy someone who's perhaps more extroverted and loves to use props. If that's not something that you're comfortable with, it's going to affect the way that you do your presentation. And then, as Zippy said, it's really important that if there's something you think you might forget, is to put it down in the notes. And there are some presenters I know who do have problems with remembering, and they might actually bring very detailed notes that they read from. And one of the most popular plenary speakers in pediatric palliative care, she always reads her presentation because she has problems with her memory. So be yourself. Don't try and be anyone else. As Zippy said, be enthusiastic, but we're enthusiastic in different ways. I use my hands a lot, and I did try and sort of subdue it, but that's who I am. I always talk with my hands, and so I've stopped trying to stop doing that. Then, as Zippy said, find yourself some friendly faces. If you get there and you stand and you suddenly think, what am I doing here? Just take a couple of quiet breaths, let a bit of a silence happen, and then start. And usually you'll find that once you start, once you're addressing your slides, that you will actually relax. And if you find yourself very nervous, then just stop again and take a couple of quiet breaths. As Zippy said, don't put too much on your slides. It's very easy to want to put everything so you won't forget, or to put big pictures and then have small font. So choose the font that is clear. There's some beautiful fancy fonts that you can use, but rather use something that's clear and easy to read. And remember that when you're talking at international conferences, English is often not everybody's first language, and it might not be yours either. And so if you speak clearly and slowly, and then at the end of your presentation, where you have your email, your telephone number. If you're at a conference, people know what you look like, so they'll come and they will speak to you and ask you questions if there's more that they want to know. I'm just trying to see if I noted anything else that wasn't on Zippy's slide, but maybe to emphasize, practice your timing. That's really important. There's nothing more frustrating than being the last speaker and then finding out that everybody has gone 1 or 2 minutes over their presentation and you're left with half the time to do your presentation. So be respectful of everyone, practice, remember to allow a couple of minutes in case you have a coughing fit. Make sure there's water there in case somebody interrupts. So allow yourself time at the end so that you finish within your time frame. And as Zippy said, just practice. You can ask your friends to listen to you. Talk to your cat or your dog. Record yourself, but just get used to what you're saying. And because we are limited with time, I'd like to then hand over back to Eve and the rest of the facilitators.
Yes, Joanne, thank you so much for the tips. And I'll now invite our last speaker, Dr. Ludoviko Zirimenya, to share some tips, and we'll move into the practical session.
Thank you very much, Zippy and Joanne. I think you shared it all. Just to supplement a bit, I will focus on delivering with impact. Just 4 key, just to supplement what Zippy and Joan have mentioned. It's always good to start strong in your presentation. Normally, when you listen to very good speakers, there are people who start with stories. They can start with a question. Do you know how many people have died of cancer the moment we entered this room? Or they can actually start with a striking fact. Do you know that WHO reports that 1,000 women die of cervical cancer after a certain period of time? It's good to start strong because at the start of your presentation, you would want to draw your audience to your presentation. Then the second is speak clearly and vary your tone. There are moments where you might have to raise it a bit. Using a flat tone kind of makes your audience drift a bit, but sometimes varying your tone also brings you kind of move with your audience. As Zippy and Joan mentioned it, maintaining eye contact, and of course a confident body language. Don't fold your hands. Don't look in one direction. Sometimes unconsciously we tend to look in a specific direction, but just have just maintain a comfortable, be yourself, as Joan hinted on. And then the last is, it's good to be comfortable with pauses. When you make a point, it's good to pause for 1 or 2. Sometimes this helps to emphasize. What I've learned, even with me, is that sometimes because I'm uncomfortable with pauses, I then tend to fill them with fillers. But it's always good as a presenter to start being comfortable with pauses because they help you in it while you're emphasizing a point. And that's all what I wanted to add. Thank you, and over. Back to you, Eve.
Yes, there is a question from one of the participants here that should they include some explanations in their slides?
Actually, I think, Joan, you did mention on that a bit. You could actually have a go. I'm guessing it's what you're going to say.
Yes, I was going to say, don't put too much detail in your slide. You can have that in your notes that you explain to people, but the minute you start filling your slide with explanations as well as information, your slides are going to get very busy. So preferably put it in your bullet points, explain as you want to explain, but don't make your slides too busy. Otherwise, people are so busy reading your slide that they actually lose contact with what you're saying.
And I have my friend here who says, what should they do if they are overwhelmed by anxiety and even the content evaporates from their head?
Take a deep breath. That's why it's important to
That's
practice
the best
before.
way. Put your hand on your heart, take a couple of breaths.
Deep breath.
And if you're very nervous, just say, I'm sorry, this is new to me. I am nervous. And, people are kind. We've all been there. And I don't know about you, Zippy and Eve and Ludo. I still get nervous before I do a presentation. I still have to take a couple of breaths and think.
Me too.
Right.
Especially if it's a keynote address and
Yes.
this is supposed to be like the one talk that everybody is looking forward to. It can be very intimidating. So taking a deep breath and maybe just saying something first before you go into your presentation that will break the ice, even maybe just giving a little bit background of where you come from, something that will just kind of now ease your anxiety and maybe make you feel more comfortable. But it is not a crime to be anxious. Yeah. It's not a crime to be afraid, to almost not talk, to lose your voice. Those things happen. We have stage frights. We have all those things. So again, maybe just trying as much as possible to present as often as you can, even when you're if you're maybe a trainer, because I think everybody in palliative care ends up being a trainer. Since we don't have enough palliative care providers, we're always training others. That is then an opportunity for you to practice. Sorry, my video is off. That's an opportunity for you to practice also. So I think the best thing is try to always engage in presentations. It doesn't have to be in a conference, just even maybe during your ward rounds or clinical team meeting. You can actually practice there as well. Thank you.
If I may add,
yes.
I think with the technologies that we have, say for example, Zoom, where someone might say, but either I work remote and I don't have anyone whom I can present to, you can actually present yourself and record on Zoom. They give you, I think this free subscription is 40 minutes. You record yourself, listen to yourself. Normally, that's when you realize the fillers. That's when we realize something, that we either I use a constant tone, across my presentation. But those are the kind of things that could help. Record yourself. Once for this current job I have, I actually had to practice. I had to practice for the job interview. So fortunately, I came across this software. It was actually Zoom, where you can record yourself presenting, so that as you present, you realize that when you're talking about this, either something happened, so you go back and correct. And the last thing I wanted to show is that as well, arrive early and test the technology. Sometimes what makes us very anxious is either you use a Mac, but then at the conference they're using a Windows laptop. The technology is different. Now we have Zoom, we have Teams. Sometimes the platforms are different. Sometimes even ahead of time, you are able to, familiarize yourself with those platforms and even reach out to the conference organizers and ask them, which technology would you use? Do you want me to send over my presentation to you? Some actually come with it on a hard drive, or you put it on a cloud, so that in case something happens with the laptop there, you're able to use an alternative other than freaking out, which we all do. But sometimes this mitigating kind of helps you maintain your nerve.
Yes, it is really good to hear from the experts in the field, and I encourage our youngsters to take heart. And we have Diane asking that, is it okay to take slow steps in front of the audience during your presentation as part of interacting with your audience instead of standing at a particular point?
Yes. As long as you have the microphone with you.
Yes, with a mobile microphone.
And you're not walking away from the microphone.
Okay. And then
there are lots of very good presenters who always walk. Always.
And especially if you're teaching.
They always get a microphone and walk.
And this is Josie. What do you do or say when you're asked a question and you have no answer? And worst, if it points to weaknesses in your program design, evaluation design, or research methodology?
Actually, one thing I've learned with growing up, that it's okay to say you don't know. And remember, it's about the message, not yourself. Sometimes, even when we are being given feedback, say, for example, someone asks you a question, I think at the back of your mind, you have to remember it is the message, not you. And for me, it's hard, but what I've learned to say is I don't know. If someone asks a question that you actually have no idea, but you say, I don't know, but that is something I will go back and discuss either with my team or with my supervisors. So the I don't know, it's still okay, because we are all learning. I'll leave it to Joanne and Zippy to come in here.
Now, I was just absolutely agreeing with you. To try and make up an answer, which they'll find was rubbish anyway. It's much better to say, look, I really don't know. But as you say, Ludo, to say, I'll go and look it up, but would you like to look it up as well and come back to me and we can discuss it later on? depending on what the question is.
Yeah, I think that's, I was just going to add that it's good to say you don't know, to be honest, because not everybody knows everything. We are all learners in this space. Sometimes I even just ask the person who asked me the question if they know better than, maybe I don't know, but they know something, they can share with the audience also, because actually that person might know and you don't know. So you give them that opportunity to also share what they know.
Thank you. Dr. Ronald Rubega, do you have any presentation that we could look at and receive some feedback on? I have Esther Tucker asking, when are we expected to send the oral presentation? Okay. Esther, we will give you a response to that question. Ronald, do you have a short presentation we can look at?
No, I do not have. I'm scheduled for tomorrow. I just wanted to log in and hear what other panelists have to say, as well as the mentors.
Do you have
But
your
I even have a question though also. I don't know, I haven't received the template for presentation. One of the things that also to note is that sometimes the conferences will ask you to use a certain template because they want the presentations to be kind of uniform. And so I was just wondering, does APCA have a template that we are going to use at the conference, or do we use our own template?
I want to confirm that APCA has an official slide deck and it is downloadable from the website. And we encourage all our presenters to use it. This is the slide deck. It has some content, but the content can be removed and people insert their content. This is downloadable from the conference website.
There's somebody asking about the link. Maybe you can respond to them about the link to send the presentation to. Is it also on the website?
And the conference organizing committee will send her an email requesting her to send the presentation, to share the slide deck and provide additional instructions. And still Esther is asking, how do we write a conflict of interest note?
Maybe Kennedy can help with that. I think usually in your first presentation after the title and everything, you should declare conflict of interest immediately before you go into your presentation. And especially if you have received funding, for example, if you have received funding from a pharmaceutical company or something like that, that has conflict of interest, so you need to declare. If you have no conflict of interest, just say, I have not conflict of interest, I have not received any, I have not been influenced by anybody. There are some sentences you use, but if you have, then you need to declare it before you go into your presentation. Dr. Kennedy, maybe you can add on to that.
Yes, thanks for that. Yeah, I don't know if that is a requirement for this conference. I'm not sure if, but actually, as Zippy has put it, you just say, if there is no conflict of interest, you just say none to declare, or you can say, I don't have any conflict of interest to declare. Say, for example, if your work that you are presenting was funded by a funder, and then maybe you are presenting that on behalf of the funder, then you have to make it clear to say, okay, this work, even though it was funded by, for example, Belinda and Bill Gates, but they were not involved in any work to do with the study design or conducting of research, interpretation, something like that. Then in that case, you are saying that actually, even though they did provide funding, but they were not involved in the actual delivery of the research. So then it means that there's no conflict of interest in that case.
And the other question I have is, how can one navigate this landscape? You're given 10 minutes and you end up coming with 30 slides. And as you on slide 3, they are saying your time is up. How do you choose what to include?
Maybe I can start on that. I guess maybe that's why this session really has been organized. It's very important because, like, I know that we feel like I should include everything to showcase so that people should know that this is what we did. But it's really about being as succinct as possible and focusing on the main things to report. I guess even the slide template, which you have shared, it should include 4 or 5 main things: the background or introduction, study design or methodology, then report the results, and then discussion, something like that. Yeah. So the main things mainly to report should be focusing on the methodology and the results. In the general rule is that I mean, a brief actually rule which I've read is that each slide you give yourself a minute. So if you have 10 minutes, focus on spending 10 minutes by ensuring that you have a minute only per slide. That's why also there was a discussion here about that you need to rehearse or practice. In that case, you are able to know where you are spending a lot of time, so that you can adjust a bit, so that you mainly focus on reporting main points. Yeah. So for example, you can have maybe in a slide, maybe there are 5 points in a slide or 5 bullet points. You don't have to explain everything. You can just say, okay, in each slide, I just want to say 1, 2, 3 things, or just report one thing on that slide. So in other words, you're not saying everything. In other words, not reading everything that is on the slide. So that's one way of ensuring that you manage your time. Thank you. That's what I wanted to say as a way of starting, but I know my colleagues should have other additions to that. Thank you.
I think just to add, thank you very much, Dr. Kennedy. I think sometimes we do these research studies and you have much findings coming out of them, but the key is always focus on 2 to 3 messages. Don't overwhelm your audience with all the findings. Say, for example, if you're doing a study using oral liquid morphine and your key finding was it able to work without adding an anticonvulsant to control neuropathic pain? Just focus on that message. Did it work? Please don't go into details, the side effects that the participants reported, all that detail, it's normally identifying what message. 2 to 3, keep it simple. Just like in a conversation, if someone is to, overwhelm with a lot of different messages, it kind of gets overwhelming. But the key, keep it 2 to 3. And I think, as Dr. Kennedy mentioned, practice, practice, practice. Because it's through practice that you can time yourself. No, then also your colleagues can give you feedback that I don't think this is necessary concerning in line with what your findings are about. So through the feedback, you can tailor the presentation, and also you are able to time yourself. Thank you, and out.
Thank you, Kennedy, and thank you, Dr. Ludo. Any other tips from you, Joanne and Dr. Zippy?
If it's around timing, I totally just support what's been said, that it's so important to practice and, to recognize there might be glitches. And it's hard. It's probably the hardest thing of all, is to compress the huge work that you've done into 10, 15 minutes. but the fact is they can always come and discover more. They can talk to you afterwards and ask more. One thing I'd just like to mention, and I think it's because doing a lot of presentations on humanitarian crises and palliative care, is if you're using statistics, make sure that statistics are up to date. You know, I listened to a presentation by a really sort of top person the other day, and their statistics were about 2 years out of date. So I'm very aware of the fact that when I talk about humanitarian things, that the stats change just about every day. So I'm extra aware of that, but do make sure that your statistics, if you're using them, are the correct ones.
Thank you very much, our dear presenters. We have 7 minutes to the top of the hour, and I can see we don't have additional questions. And since this webinar is going to be availed online, I'm sure very many of our oral presenters are going to take advantage and use these nuggets to deliver quality presentations at all upcoming palliative care conferences within the region and globally. Unless anybody raises a specific question, I would like to call this webinar to a close. And tomorrow we are going to have a conversation with those who are preparing for poster presentations. Shupi, anything from you? Or
Thank
Rose?
you.
Great. Thank you very much, everybody. Have a wonderful rest of the day.
Thank you, everyone. Thank you.
Bye.
Thank you.
Take care.
Bye-bye.
See you at the conference.
Mm.
Yeah.